Hello and welcome back to my at-home wound care series. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over how to take care of your pressure injuries at home. But first, if you could smash that subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started. So what is a pressure injury? So a pressure injury, also known as a pressure sore or a bed sore, is an area of discolored or broken skin caused when the skin is pressed against a surface. It can happen because the pressure against the skin is for too long or too intense. So it's really pushing really hard. Or it can happen if you have both. It can also be caused or made worse by a force called shear. So it's kind of when um, you are shearing against it. So say somebody is being pulled up in the bed and they're not being like lifted up, more pulled, and it can have that shear force. So pressure injuries usually occur over a bony area such as heel, tailbones, and hips. The pressure causes the skin and the tissues underneath to be pressed against the bone, and this compresses the tissue. It reduces or stops the blood flow, which can cause damage to the tissue and lead to a pressure injury. So common causes of pressure injury include sitting or laying in one position for too long, so we should be moving that position every 2 hours. Sitting or laying on an object such as a catheter tube, a sling lift, or even a wrinkle in the sheet or clothes. Improper posture, incorrect methods of moving somebody to a new position, incorrect use of using equipment like wheelchairs or specially wheelchair cushions or mattresses. If they're not being used properly, it can cause pressure injuries. So in this slide, I did just add a picture of the most common areas where you do get pressure injuries. And most of these are happening in people who are not moving or who have lost sensation and can't feel that they need to move or can't move themselves. So what can lead to a pressure injury? Lack of ability to feel most of the time when you have been sitting too long in one position and your tissue has been pressed against a bone and a surface that you're sitting on, you probably feel some sort of discomfort and shift your position to relieve the uncomfortable feeling. You probably do this many times an hour and don't even think about it. But there's times when it's not so easy or even possible to do. Conditions like multiple sclerosis, spinal cord injuries, diabetes, paralysis from stroke, or even some medications like painkillers can increase your risk for a pressure injury because these conditions may block your ability to feel the uncomfortable feeling caused by the pressure. In these cases, you might continue to sit or lay in the area, reducing the blood flow and causing damage. Lack of ability to move as well. Anytime you're unable to move positions, you are at risk for developing a pressure injury. These can occur if you have paralysis or extreme weakness, or if you're unconscious or deeply drugged. If you can't move yourself and can't communicate to others that you're feeling uncomfortable and need to move, a pressure injury can occur. Poor skin health also plays a role too. If your skin is too wet from urine, stool, sweat, saliva, or wound drainage, it breaks down a lot easier, putting you at a greater risk for a pressure injury. Skin that's too dry is also a problem. As well, if you're not drinking enough water or eating the proper foods, you are at higher risk of a pressure injury. So how long does it take to develop a pressure injury? So sometimes it doesn't take very long. It can take as little as a few minutes to several hours. It just depends on what's causing the pressure, where it's located on the body, and the health of the person. Areas that often get a lot of pressure, such as heels, elbows, and tailbones, may become red and discolored quite quickly in people who spend most of their time in bed or in a chair. If the skin and bony areas are not protected, they may worsen and become an open sore. Once you have had a pressure injury, that area is more likely to get a new injury even though it is previously healed. So what does a pressure injury look and feel like? So some pressure injuries have only minor skin damage and some have complete breakdown to the skin and other tissues, including muscle and bone. So a pressure injury may appear just like a red, warm, tender area of unbroken skin. It may have a blister filled with clear fluid, and the redness doesn't go away when the pressure's taken off. It can also look like a purple or maroon, warm, tender area of unbroken skin. It could have a blister filled with blood, or it can go all the way to having broken skin, and it ranges from just a shallow hole filled with just slight moist pink tissue, or it can go to a very deep hole filled with red, yellow, brown, gray, black tissue that drains a lot of fluid. So what can we do? If you're the person taking care of the person at risk of a pressure injury, you're going to want to follow the steps below to prevent skin breakdown caused by pressure. So we want to look after the skin. So keep the skin clean and dry. You don't want to give hot, long baths. Just short, warm showers are a better choice. Use a mild, fragrant-free skin cleanser and a soft washcloth when cleansing the skin, and just pat the skin dry. You want to dry well, but just pat it dry, making sure that skin folds and in between the toes are done very, very well. You want to moisturize the skin with a mild, fragrant-free moisturizer. You do not want to go in skin folds or toes, okay? Do not use moisturizer in these areas. They already stay moist as it is, so we do not want to add moisture. And it's best to moisturize right after patting the skin dry. You also want to look at the skin for signs and symptoms of pressure damage daily. Use a mirror or have your care partner help you, and eat a well-balanced diet and drink lots of non-caffeinated fluids. It does help tremendously. So keeping the pressure off is the most important part of prevention or treating a pressure injury. If you're not removing the cause of an injury, it will just continue to get worse, okay? So we want to make sure that we're removing the pressure. So make sure there's no pressure for long periods of time on any part of the body, from sitting, laying, or any type of equipment such as shoes, casts, braces, breathing tubes, or other medical devices, okay? They can all cause pressure. The suggestions below can help you yourself or the person that you're caring for be safe from a pressure injury. So changing positions every 2 hours. 2 hours is the max that you can go. If you want to change them more frequently, that's great, but max is 2 hours in one position. You're going to place pillows between your knees and ankles to keep them from touching when lying. Reduce the shearing that happens when you slide down in a chair or bed by making sure that you're lying or sitting correctly. We're going to reposition safely and correctly. And then we are also going to use a turning schedule. For people who can't turn themselves, we want to make sure that they're on a schedule so they're not being missed, because they do definitely have to be move positions every 2 hours at the max, because we do not want to be creating sores. If we get a sore, they're extremely, extremely hard to heal. So what do we do if we have a pressure injury? So if you notice that you or the person that you're caring for gets a new pressure injury, you want to contact the healthcare provider as soon as possible so we can create a plan to treat this wound. Now, part of the plan will involve following most of the prevention steps that was in the resources before, because pressure injuries will not heal if the pressure is not removed. So we have to continue with all the prevention steps to even heal the wound, okay? So making sure that we're moving, that the pressure is not there. So honestly, with pressure injuries, prevention is number one. because once we have them, super hard to get rid of, and then they will continue to come back time after time. So that's all I have for this video on pressure injuries. If you haven't done so already, if you could hit that subscribe button, it would be greatly appreciated, and I will catch y'all in my next video. See you guys.